Good evening, everyone. My name is Nathaniel Grenner. I'm a student physical therapist assistant. I'm interning right now at Smart Body, and we are here tonight for this presentation on ACL prevention, injury prevention in female athletes. And thank you all for coming. So we're going to go ahead and get started. So ACL stands for Anterior Cruciate Ligament, and basically the job of the ACL is to prevent anterior, we call it anterior translation. As you can see right here, the ACL runs from the tibia, which is your shin bone, and runs to the femur, which is your thigh bone. And so since it runs from here to the back of this bone, when athletes plant, it stops your femur from going forward. But the ACL is also coupled with the PCL, which is the posterior ligament, and runs from the backside to the front, from the shin bone to your femur again. And the MCL and LCL are the collateral ligaments, which prevent, like if you were to get hit on this side of the knee, it would prevent those motions. And so they all kind of help stabilize the knee. On top of the ligaments, you have your knee as a whole has a joint capsule, it has a synovial membrane, which is thick connective tissue, and provides synovial fluid to lubricate the articular cartilage of the joint. So it's just that's the joint structure as a whole, pretty much in a nutshell. So just here's some facts. In the last 3 decades, there has been a tremendous increase in female sport participants. There is an annual incidence of more than 200 cases of ACL injuries, which is a lot. In the U.S. alone, there's more than 30,000 serious knee injuries projected to occur in female intercollegiate and high school athletes every year. So that's quite a bit. And it's very prevalent in younger females too, not just those age groups. And females that provide or play in sports that require like jumping, cutting, pivoting, quick movements that require stability of the knee are 4 to 6 more times more prevalent than males, which is pretty significant. Some of the causes and contributing factors, the anatomy of the female compared to the male, there's a couple things here that research shows. The Q angle, which stands for your Q for quadriceps angle. Your quadriceps runs from, as you can see, up here, your anterior superior iliac spine through the patella. It's measured this way and runs from the tibial tuberosity up through the middle of the patella. And that angle is significantly less in males because basically females have wider pelvis as hips. So with that angle being wider, it kind of their knees can collapse easier. It puts more stress on the joint and possibly collapse. Then there's the femoral notch where the ACL runs is suspected to cause damage. Well, it can cause damage during performance because that also is more narrow in females. And with it being more narrow, the ACL is running through there and can cause like a shearing force of the ACL and cause breakdown with repetitive trauma. Another thing with females is they tend to dominate with their quadriceps more than their hamstrings. So when landing, instead of absorbing it with using their quadriceps or their hamstrings as well, they'll land with more of an extended leg. Like she's landing kind of awkwardly, but her leg's almost extended right here. So that can, along with it being an awkward landing, that's just to picture an example, but basically that can cause a lot more impact on the knee just because of that. So that's another thing that research shows. And just growing up, as it says here, like females aren't as active with sports and practice and playing like generally than males. So they're not as developed to handle, like when they get into more competitive sports when they grow up, they don't know how to react as well, like their tissues, their whole neuromuscular system. Another big thing in females is after puberty, the hormone receptor sites for estradiol, which is a form of estrogen, and progesterone and testosterone, they affect the ACL. So during the ovulatory phase in the menstrual cycle in females, there's an increase in, or estradiol, sorry, and that causes laxity in the joint, so, well, the joint and the ligament. So with laxity, that's going to increase the probability of the knee not being able to stabilize itself. Here's a couple of tests that you can do to kind of see how a female or male athlete, how they're, if they're likely or susceptible to an ACL injury. The first one we have up here, the drop test, is primarily used in athletes to assess the athlete's knee alignment on landing from a jump. So basically what that is they jump off of a box and land, and when they land, they have to jump again and land again. So what you're looking for when the athlete's jumping off the box is to see if the knees collapse in, and it's called a genu valgum, which is causes a lot of compression on the knee. And the triple hop stability test look for the ability to stabilize on a single leg landing. So when you're standing on one leg, the hip is a big component, and if you have a weak hip and can't hold yourself up, when you're running and cutting and doing active stuff, you're a lot more susceptible to strain or stress the knee. Then you have the single leg squat test. It says here the ability to perform 5 consecutive repetitions squatting as low as possible and maintain balance. So just one leg, which is pretty tough, but once again, that tests the hip strength. Athletes that are going to be playing in sports of the nature they're playing in today, I mean, it's huge to have this strength. So even though this is a tough test, these are athletes, not just everyday girls that aren't performing and stuff like this. And there's a couple other tests to check for, like the quadriceps dominance, leg dominance. Like if you use your left leg a lot more, if it's a lot more strong than your right leg, then that's gonna cause imbalances and problems. So here's a couple things for athletes that they can do to help prevent ACL tears. It's pretty much like a warm-up regime before you could do before practice, or pretty much every day before training. As you can see, the dynamic warm-up with this just kind of does active stretching with, you have the straight leg march is, you're bringing your legs up and you're stretching your hamstrings primarily with that. And then the other one, the hand walk, you're actually down on your hands and keeping your legs straight, walking. Then you have the cradle walk, hip rotator walk. There's a couple dynamic warm-ups up, the plyometric drills. Those kind of help get your joints ready for impact, pretty much help strengthen the muscles and response times. Then you have some strength drills here. The steamboats are just, usually if you have a resistance band or something like that, you'd hook the resistance band up to your leg and then bring your leg out in front and to the back. Then we have a couple flexibility stuff you could run through and stretch the hamstrings, hip flexors, quadriceps. And the other component of warm-up is like agility drills involving like quick feet, or like the Nebraska drill, which quick feet is just kind of going up and back laterally. The Nebraska drill is where you have like 2 cones set up about, I think it's 20 yards apart, and you run to, say, the left side of the cone, pivot around it, run back, and then run straight, and then run backwards all the way back. So it's just getting the joints prepared and in flexibility, strength, and trying to make them a little bit more durable. If you do these frequently, it's proven to help significantly. There's a couple things I found interesting. The American Physical Therapy Association, APTA, states that the specialized stretching, strengthening, agility, and jumping exercises could lower the overall ACL injury rate among female athletes. And outcomes from a study of Division I soccer players that performed in an ACL prevention program had an overall ACL injury rate 41% lower than a group of female athletes who did their regular warm-up. This was one of the largest studies that conducted an NCAA with 1,435 athletes participating. So it was obviously a pretty significant study and a very high percentage decrease of ACL injuries with the program, so that from this study alone, it's a very effective thing to implement these programs into athletes' practice and pre-practice. So basically, what we can do to help prevent this injury is these things, and educate yourself and look into these things, and just realize the importance and the, I mean, as you can see from the stats, there's been a lot of ACL injuries in the last 3 decades because there's been an increase in female athletes, and they're not obviously taking the right preventative measures. So these are some things you can do. And Dr. Ellen Bass here is going to go over a program we're going to have here at Smart Body Physical Therapy.
Hello, everyone. Again, I'm Ellen Bass, and it's my pleasure to be here tonight. I'm really excited about ACL prevention in the female athlete. I am going to be heading the program here at Smart Body for the ACL prevention, and what we're going to do is we're going to do a 6-week program, 3 times a week, Monday, Wednesday, and Saturday, that we'll be offering here at Smart Body. What it would consist of all the things Nate talked about: the dynamic warm-up, flexibility, strengthening. Plyometrics is a big part of ACL prevention, so I'm really passionate about this. I played Division I basketball, and as part of, in my 5-year, I played for 5 years. I did a long program. But in my 5 years, I saw 6 people tear their ACL, and 6 of my teammates, in just 5 years at the college level. So it was a huge impact on our team and on their careers as athletes. So I just think the prevention can't be understated. So I'm really excited, and I hope that we can have some fun with it, and hopefully some people will attend. And that's it. Right? Do you have anything else?
No, I don't have anything else. Does anyone have any questions? Or? No? Thanks, guys. Thank you.